very important for patients to know some of their basic history. They may be in an emergency room where nobody knows them. They may be on vacation somewhere. So I think it's very important for patients to know, their basic history, the basic, problems that they've had in the past, basic concerns, so they can relay those to the physician, how they've been treated in the past. If they have a surgical history, for example, that's important to know. And most patients kind of know what works for them if they have a pain crisis. So the more knowledge you have, the better.
It's important to remember my complete medical history, just in case you're in an emergency, especially for me. If I go into a crisis and I'm in Philadelphia and I have no way of getting to New Brunswick, then I have to know these things so I can tell the doctors that are going to help me there, like what's going on, what my blood type is, what insurance I have.
Having sickle cell, you always have to have a backup plan or know what you can and can't do. Like, I was in Jamaica this past week and I landed 3 hours ago. So when I was in Jamaica, there's a lot of things that I couldn't do. I was with a few cousins, and they're swimming in the beach all day, and it was starting getting windy, and they're like, come on, jump in, and I'm like, I'm just going to play in the sand, even though I wanted to go in because it's 90 degrees. It's in Jamaica. I was able to go in the water for maybe 5-10 minutes, but I came out because I knew if I stayed any longer, it would have not have ended well for me.
As you get older and you do a lot more things and you travel and you're away from home, away from your healthcare providers, if anything happens, which anything can happen, you have to know so you can relay the information to the people who are trying to help you. So, for example, if I'm in Australia and I get in a car accident, if I'm awake and letting them know, I have to let them know, hey guys, I have sickle cell, just because there may be some medications that I can use. For example, I went to urgent care the other day, or not the other day, a couple of months ago, and I had an allergic reaction, and they gave me a medication with steroids in it, because that's what you use for allergic reactions. And I'd never encountered this before because I'd never had a severe allergic reaction. Basically made me stay in the hospital for a week.
Normal oxygen level is usually like a 98, sometimes 100.
Having sickle cell is definitely a lot of discipline because there's so many things you want to do, and if you do it, what can happen and the severity of it. I'd rather say I can't go swimming with you guys today at the beach than go swimming with my friends or family at the beach, and 2 hours later, I have to find a hospital because I'm in severe pain.
My blood pressure, it's about a 115 over, I want to say 55 maybe. I'm really not sure.
The transition is very tough to just learn how to take care of yourself. And like you said, parents, medical team, they all come together and they're the ones that really help prepare you on what to expect and what you're going to face. My earliest experience with me, like seeing that transition kind of, was when I was 10 years old, and this was back in Nigeria. And being the only child, my mom gave me the best care. She did everything for me. She would give me vitamins, food, everything I needed. And I wanted to go spend time with my friends for like summer vacation for a week. And she was really, really against it, but like I was crying, I was begging. My dad was like, just let him go. And I got there and it was fun. It was like in Lagos State, which was like the equivalent of like New York to Pennsylvania, the distance. And I get there and I'm playing with them and we run up like something like 15 flights of stairs, just running. And then I got sick that night. I was in intense pain that night. They had to call my mom. She had to rush over there to pick me up and things like that. And that was when she first told me, this is why you have to know how to take care of yourself. Because with sickle cell, even though you could physically still get up there and climb 15 stairs, you're going to get pain after. Your friends are not going to get pain after because they don't have sickle cell, but you are. So that's when you have to know, in those situations, you tell them, listen, I have sickle cell. I'm not going to be able to like run up the stairs with you at the same pace. I'm going to need water. I'm going to need this. I'm going to need that. So that was kind of my first experience with learning the difference and handling it myself. And then once I got to the United States and I got a little bit older, around the ages of 13, 14, the healthcare educators were just explaining to me what I could do, what I couldn't do. my limits in a sort of way and just explained to me everything about the disease. And I had like a holistic understanding. And that's when I fully understood my body in a sense. And it was through the help of the healthcare practitioners and also my mother. Something that my doctors would always tell me, to get your eye exams with specialists. It's just not your normal eye exams, but with sickle cell SC, there's a chance that you could go blind from complications. I don't understand the science behind it, but I do know there's a chance you can go blind. So you always yearly have to go see a specialist eye doctor in order to be able to just check for it, make sure everything is normal, and make sure everything's working perfectly fine. And if they catch it early enough, it's very preventable, it's very treatable, but the problem comes when you don't catch it early enough, and then it's in motion, basically.
In regards to surgery, if you're going to have anesthesia, there's often specific prepping that needs to be done to prepare you for the anesthesia, because patients with sickle cell disease are higher risk patients in regard to surgery and complications afterwards, because there may be some lack of oxygen or deoxygenation at the time of anesthesia induction. So it's important that these patients are very well hydrated at the time of surgery, and sometimes we transfuse the patients prior to surgery. So it's important. Everybody's individual. Not everybody needs this specific preparation for every specific procedure. So we recommend is any time there is going to be any potential surgery or even dental work involving anesthesia, that call us so we can work with the other professional to make a specific plan. By definition, if you have sickle cell disease and you are pregnant, it is a high-risk pregnancy. But anybody with any chronic illness, could be diabetes, asthma, etc., very often pregnancy is a bit more high risk than the average person who does not have any underlying illness. We recommend strongly that anybody who is pregnant with sickle cell disease or contemplating being pregnant who has sickle cell disease, that they see a high-risk obstetrician who has knowledge and is comfortable with sickle cell disease, so they get the proper care. You can have babies and you can do very well, but you may need to have some additional monitoring and intervention during that time. If you look at the natural history of sickle cell disease, the lifespan is open-ended right now. People are doing very well, but there's a clear correlation between not having follow-up appointments, not being followed closely by a hematologist, and not doing well. And it's something that's worth making time for. I always tell the kids, you can always play the video game later, but you need to come to your doctor's appointments.